My name is Jeffrey Chernick. I'm the Chief Strategy Officer at MedResults. As explained, we are a medical device manufacturer, distributor. We work all over the country. We have a global arm, and our flagship device that you know and you love is called the Plexr Plus. And today we're joined by two practitioners, Dr. Chris Crowley and Allie Ballew. And they're both from Skin Tonic, a very cool med spa in Florida that you're going to hear all about. And I thought I'd change it up a little bit today because, we do these all the time. Dr. Crowley joins us, and a different question than a biography, but Chris and Allie, how did you get into this space? That is my question, because you both come from different backgrounds and you're both working now and Chris, as a leader in the space, and Allie is probably several years, I think. So yeah, I'm curious. So that's my question to both of you as the interviewer is to Chris, how did you get into the medical spa industry?
Yeah. So I'm gonna steal Allie's thunder and say how she
Go right ahead.
Yeah, they know a lot of you guys know my story. And so I really was kind of drug into aesthetics. It wasn't something that I really even thought about by my husband, Jerry. And so Jerry is a nurse practitioner at Skin Tonic as well. And he entered the aesthetic space as a registered nurse, as an RN in Illinois. And he was doing a career change. I was the director of the anesthesia residency program at Rush University, and he was going to take a beginning neurotoxin class. This was actually a little over 16 years ago. And I just tagged along with him kind of for fun. I thought it was fascinating. It was interesting. It was a lot different than the career that I had at the hospital. But honestly, I still didn't really see it as a career. Through a series of family events, a year or two later, my dad passed away pretty suddenly, and my mom and family needed some support here in Florida, kind of where we grew up. And we moved back, and the laws were different. Jerry could no longer inject. We wanted to kind of pursue our, med spa development. And so I started injecting more. We had a med spa location over in Alabama, and there it's physician only injection. And so because of some of the laws, I had to be more involved and start injecting more. And I actually loved it, found a passion for it. I still worked some in anesthesia and critical care, and just over the years slowly transitioned out. Many of you guys know that my true passion is education, and I love sharing my knowledge with a lot of new people entering the space. It's really, I get a lot of joy out of that. And so over the years, when Jerry got his nurse practitioner and started, we opened our practice, Skin Tonic, and got busier. He's doing a lot more of the clinical stuff, and I've been able to travel and teach and share my knowledge. In that time, I met Allie, and she was an ICU nurse, and then I was her preceptor for her acute care nurse practitioner. So the goal originally was to have her work in the ICU as a nurse practitioner. I don't think you really thought about aesthetics very much either. You were a consumer, and you liked the
yeah, I saw Jerry at the clinic, but
you saw Jerry at the clinic.
Well, tell me your story, Allie. Tell me from your perspective, what was the experience?
Yeah, so like Chris said, I was, fully going to go into acute care, thinking about a very hospital-driven, education specialty in the NP world, and did a full year of clinical with Dr. Crowley in the ICU. And I kind of got towards the end of my clinical, was getting close to taking boards, and he was asking like where I thought I was going to apply for. And I was like, I don't know, like maybe infectious disease, cardiology, I don't know. And was just really going to hunt for a job, to be honest, whoever would take me, because getting a fresh nurse practitioner job isn't the easiest. And he was like, well, what do you think about aesthetics? And I said, well, I like it. Like, I would be interested in it. And he was like, okay, well, just come work for me and Jerry at the clinic. And so I got the best opportunity I've ever been given, and I have loved it so much. I've been in Skin Tonic now for over 2 years, and I've been teaching with Empire Medical Training as well for getting close to maybe 2 years now. And so I also really love teaching a lot more than I thought I would. I used to be like super nervous about it, but now I do really enjoy it. And So yeah, that's kind of how I landed here. And we've had Plexr in our practice now for, I think it was 9 or 10 months now. So a while, and we love the Plexr. We use it daily at the clinic. I'm pretty sure my very last patient was a Plexr today. So, and then I scurried home to do this webinar for you guys. So I'm super excited to talk about the Plexr shower and glass lift today.
Super cool. And I asked these questions because, you know, when you do these webinars, we try and relate to the audience that's on the Zoom and taking their time. And there's just so many people, not everyone, but there's so many people that are in the hospital system, doctors, nurses, just people who are working, an anesthesiologist, like people who are in the system and have this dream that maybe they could own a med spa. It's lucrative, it's different, they could leverage their skills, and we're going to be hearing from, you know, you're like success stories, you know, 2 success stories right with us today.
Yeah.
So it's not just about like, it's not here to do a product demo, but it's about to learn from your peers and see, you know, some people on this call have already had practices thriving for 10 years, and other people are in the exact boat you were 2 years ago, 5 years ago. So thank you for being on. I'll pass the mic over to Allie, and we're going to be diving into the Plexr Shower today, learn a little bit how you're using it in your practice. And then as you're coming up with questions, please put them in the Q&A box, not the chat box, but the Q&A box. And we will get to all questions. So add them there. I see your screen perfectly, Allie. Thank you so
I
much.
do.
Okay, perfect. And go ahead, on your way. There you go.
Yeah. So like they said, I am Allie Ballew. I'm a nurse practitioner at Skin Tonic, a med spa in Pensacola, Florida, Pace, Florida area. And I'm super excited to talk to you about the Plexr Shower and Glass Lift or Rockstar Treatment that Paula Abdul certainly loves and has made pretty famous. So we're going to go ahead and get started. And any questions you guys have, like she was saying earlier, just go ahead and type those in the Q&A as they come to you, and we will address all of those at the end. All right, so this is going to be your Plexr Plus workstation that you either have and are learning to use or will purchase. So as you can see, the workstation comes with 3 different hand pieces. There's a white, a green, and a red. Each of those are going to be different levels of power. So the white one is going to be 0.7 watts, the green 1 watt, and the 2 watt is the red pin. So you're going to use all 3 of these different energies for different levels of treatment, different patients in your practice. And then there you can see the iSmoke E, which is a smoke evacuator used primarily for the more ablative procedures, which we're not getting super far into today, but we can certainly discuss. And then just quickly for Plexr, they do offer great training. So they offer Zoom training, 2 to 3 sessions with 24/7 access to a training portal. And you can even do a free in-person at their academy out in LA, or a paid in-person training at your location. So all of these are great resources to use if you do purchase Plexr, that I highly recommend. And they also offer a marketing program. So in addition to the technology, you're also going to get great support if anything ever happens, you know, to your Plexr during practice. We haven't had any issues with ours at all, but they also have a great support for technology as well. But they do have some marketing strategies that can help you get started with your Plexr treatments. And Plexr offers treatments for many exclusive indications unique to this cutting edge technology. So let's get into the technology of plasma and what it is. So plasma is one of the 4 states of matter. So you have solid, liquid, gas, and then you have plasma. So plasma is made up of charged particles, which are going to be your ions and electrons. And Plexr uses atmospheric nitrogen to produce that plasma. So plasma is not, it's a much higher degree temperature than a laser, as you can see here. So lasers are going to stay around 300 degrees Celsius, and plasma energy is going to be 20,000 degrees Celsius or higher. And so again, just wanting to touch on the atmospheric nitrogen part here. That's super important because some of these different devices on the market are going to require a nitrogen tank. Plexr does not. And so that makes this super lightweight, super portable, a very easy way to access this, along with the 3 hand pieces that can all be used at the same time in your clinic. Alrighty. And then, so Plexr it creates this plasma energy using high voltage pulses. So what this means is that you're not using radio frequency or a continuous high electrical current. So because the plasma is generated with those high voltage pulses, the energy is going to be measured in watts that we talked about earlier on those 3 different pins. This briefly goes into sublimation. That's going to be used for the higher energy pins with a different tip than what we're going to be talking about today. But basically is saying that sublimation transforms solid tissue into gas. And so that's completely removing tissue right before your eyes. It's really cool to watch. We've done some really great mole removals successfully, skin tag removals, scar removals, keloid removals, all of these things that can be done right before your eyes in one sitting. And so it's really cool to be able to achieve these results without going under surgery and using actual cutting technology. Some of the things that we like to use this for in our practice is the barcode lines that people will get, the smoker's lines, upper, lower, non-surgical blepharoplasties, scar revision, and also non-surgical labiaplasties. All right, so again, we're using clean plasma technology, and this graphic does a great job at demonstrating how the energy is dispersed over the outer layer of skin. So instead of other devices, how they'll dive through the epidermis, possibly get down to the deep dermis, this is going to spread the energy just over the outer layer of skin and literally shower it. And so when you're not putting your patients at these deep dermal risks of thermal damage, possible necrosis, that's going to give your clients a lower downtime and, more importantly, in my opinion, less probability of complications. We always talk about in our practice, safety first for our patients. And I think this proves, just how safe this treatment really is. Alrighty, so moving on, here is a picture of a confocal microscope study. The before pictures are obviously going to be to your left and the afters to your right. And so in this study, this shows 2 different patients. These were actually done on a non-surgical Plexr blepharoplasty. And then here, when you look at the images on the right, you can see the high degree of collagen remodeling that has taken place. That's evidenced by the brightness of the white collagen that you can see, those strips, and how they're parallelly aligned. That's showing the strength, the improvement in tissue, and the regeneration that's occurred underneath the skin. And that's why we see, the great results on the outside. And I believe in this study, these pictures were taken, or these microscope photos, these were taken about 8 months after the original procedure. All right, so with Plexr, you get all the tools for triple depth skin remodeling. It's always important, obviously, to tailor treatment to your individual client's needs and select an appropriate pin energy and pin tip for what you're trying to achieve. That being said, Plexr is safe for all Fitzpatricks, which makes that's a super important thing, when we're deciding what products, what procedures, what devices we're going to bring into our clinic, because we like being able to treat all skin types. And so obviously, you might choose a lower energy pen and doing a Plexr shower versus a more ablative treatment on a person that's a Fitzpatrick 4 or above. But it is possible to treat all different skin types with Plexr. So these 3 modalities are categorized into non-ablative, semi-ablative, and then completely ablative. So for Plexr and shower and glass lift protocols, we will be referring to the nano-ablative approach. And then here you can see all of the pins that we talked about earlier. This just kind of goes over, Plexr shower is nano-ablative. The cat resurfacing is the semi-ablative. And then the soft surgery, you're going to be using the ablative plasma. How long do Plexr results last? So Plexr results are going to last depending on the level of treatment that you do. So for non-ablative procedures, what we're talking about, results can last up to a year. For semi-ablative, up to 2 years, and up to 5 years for ablative, or permanent for scar revisions. And we've definitely seen this in our practice. You can also, if you're trying to get a great result with minimal downtime and people opt for the Plexr Shower approach, you can also package these and do a series of them. We've found that super helpful in our practice, offering series packages to these people, encouraging them to come back and get repeated treatments to get longer lasting results and also more improved results. All right, so Plexr Shower, what we're all here to talk about. More results, less downtime. So that is one of my personal favorite things about Plexr Shower. It's the immediate result you get with the minimum downtime. I feel like there are a few devices on the market that really check both of these boxes at the same time, and it's really filled a void in our practice. So much so, and people, I honestly was a little skeptical at first too. They tell you, do one side of the face first and then show the client a mirror. And that's where you really see that the clients are so happy with the results. And, clients can be hard on you. They'll be like, I don't see anything. But I have never had a patient say that they were dissatisfied or say that they can't see what I'm seeing of the immediate tightening that is happening to the face with a Plexr Shower. So here is one of our lovely clients at our clinic at Skin Tonic. So this result was achieved with just 2 sessions, no downtime. So I can tell you this is 100% not photoshopped. I know this lady, we see her regularly. And this is after just 2 treatments. So she's not had any tox, no fillers. While you can use those in combination with Plexr, she has not had any of these things. And this just really, to me, speaks volumes about the results that you can see with Plexr just after 2 sessions. And she did come back for a 3rd, so she looks even better now. Here's another great result from Plexr. This is from another practice. We've seen similar results to this in our practice, though. So this is actually an acne treatment, and not that we're talking specifically about acne today, but Plexr Shower does a phenomenal job at treating acne. With the increased temperatures with plasma energy that we spoke about earlier, they do work very easily to kill any active bacteria, and that's also going to work while improving texture, tightening the skin, and leaving you with a really pretty smooth glow. So we've had some great acne results. And the Rockstar Treatment with Paula Abdul. So this is referring to the Plexr Shower. Paula Abdul has been getting this treatment and has been super excited with the results. Up in the top right, you do see a price point there. There are price points throughout this presentation, but I do want to just note that always, be mindful of the price point in your specific area. Obviously, somewhere in Alabama isn't going to be charging what they charge out in LA. And so I think it's really important to know your market and to know what people in your area are paying for similar treatments or similar results, so that you can properly price your different Plexr treatments. And each of your Plexr treatments are going to be priced differently too. That's important to note. A Plexr Shower, a nano-ablative treatment is going to be priced typically lower than a fully ablative treatment. And we certainly do that in our practice. Okay, so no bleeding, needle-free, and painless. So this slide is kind of discussing how is Plexr Shower, how is that different from microneedling? Sometimes people will refer to Plexr Showers as an upgraded microneedling. So it's different in that Plexr creates micro entries into the skin with energy instead of mechanically with needles. So this also is going to remove ultra tiny pieces of skin while you're doing the Plexr Shower. And that's what gives the client immediate tightening. while also opening the channels that Plexr makes in the skin. And that's going to get the skin super receptive to any medical grade products. It's going to help them to absorb those products easily, giving you better results from those serums and products from immediately after the treatment for up to 4 hours later. So when we're doing Plexr showers in the office, I will apply whatever serum is appropriate for the patient, whatever goals we're trying to achieve immediately following the completion of Plexr shower. And then I will also typically send them home with a little dropper vial of some more of that product and tell them, you know, I want you to make sure and use this whole bottle up within 4 hours. You know, sometimes I'll tell them, you know, do a little bit, do half of it 1 hour later and half of it 3 hours later. The most important thing is that all of that gets absorbed into the skin within that 4 hour channel open window. This is a good example of, again, why Plexr shower can be preferred to traditional microneedling. The video of the sponge on the left is kind of showing how, you know, whenever we finish microneedling patients, there's going to be a little blood, a little serum left on the skin. And so that does take up some of the space that you could be absorbing premium medical grade product. Whereas the Plexr, you're going to end with a dried, the same skin you started with, but it does have those micro channels open and ready and receptive to absorb any of those actives. Again, another comparison slide. I think really important to note here is the no anesthesia, no numbing time, no numbing cost. And so this makes it a super quick procedure. You know, these can be done in 30 to 45-minute appointment times, which means you can see even more patients. Whereas with microneedling, you know, in our clinic, we typically numb for, you know, 10, 15 minutes before starting, and numbing cream is not cheap, especially if you get the good stuff. So our disposable tip cost for Plexr shower is $20. Your esthetician can perform it. So our esthetician definitely does the majority probably of our Plexr showers, but it's so popular. I'll tell you that myself and Jerry, Dr. Crowley, we all do it in the practice because it is such a sought after treatment, because we have been doing a ton of it and the results have been crazy. You know, social media is your best friend. Definitely post your results out there. And it's become probably one of our most popular treatments within the, I don't know, a couple of months. You know, everyone was started asking for it by name. Alrighty. All right, so step one is making micro holes with nanoplasma bolt sublimation. So this is going to give you that immediate lifting and skin tightening effect while making those micro holes. Again, no numbing is required, so minimal discomfort with this as long as you're using the proper techniques. I do have one of our Plexr pens here with me today. I hope you guys can see it good. I know I have the blurred effect on, but so when you're going over the skin, you want to make sure and keep it on the skin, just barely above the skin. So lightly going back and forth in a pretty steady motion, and about this speed, if you guys can see that. What you don't want to do, every time you pull up from the skin, you could see, you know, if I were to turn it on right now and hold it more above the skin, you can actually see that pulse from the plasma energy. As you can see, whenever you turn it on, there's just a little button here. So you click that on, and as you can see, there's a light on the end of it. This light actually stays on for 3 minutes and then it auto shuts off, or you can press the button again and turn it off yourself. So that's kind of a quick little how-to with the pen itself. Obviously, it's important to start on a clean surface with skin that is dry. So typically, you know, we'll remove any makeup that the client has, let them wash their face or help them wash their face. And then we're going to go ahead and wipe the skin down with either alcohol or like a Purison, something that's going to help dry out the skin, because you won't get the plasma energy, those micro pulses. You won't get that without having dry skin. Oil, makeup, buildup, stuff like that is going to keep the effectiveness down. Alrighty. So this is a great photo for you guys. Maybe take a picture of it if you guys have Plexr in your practice or even don't. This is a really great way to divide the face into 10 equal areas, allocating 3 minutes per section. So like I said, the pen itself is going to auto shut off at 3 minutes. So as soon as you see that light go off, it's time to move to the next section. And so you can start in any of these sections, but it's blocked off between forehead, preorbital, cheek, preoral, and jaw lines, both left and right. And so that's about 15 minutes per side of the face. These are some videos that have been clipped in for you guys, so you can probably see it better than you can see me live on Zoom. Noting the speed, typically we go back and forth like you see happening on the forehead in the right video. On the eyelids specifically, you kind of want to stay in one direction just because that skin is thin. And you can see he's also doing a great job, this provider is, of pulling the skin taut. You don't want to be pushing the skin around, especially with patients who have more skin laxity. It's really important to hold the skin taut so you're not pushing the skin around. Oh, and I didn't even mention, that is my favorite thing about Plexr, is we have so many patients that are concerned with how their eyes look, and you can't microneedle an eyelid. So that definitely gives us a leg up. All right, so step 2 is nourishing and treating the skin with proper active ingredients and boosters. There's tons of different actives that you can use, different ones out on the market. There are a few clipped into this PowerPoint presentation that we'll talk about. And like I said, the most important take home, I think, from this is applying immediately after and knowing that those microchannels are going to be open for 4 hours after, and that you want to make sure and get all of that product in within that time frame. All right, so this is the Active Bar medical grade skincare line by Uplifting Skincare Labs. They've created protocols actually in combination with Plexr to target the needs seen below. So it targets, acne, pigment, aging, etc., whatever you need. And so this is a really great option for skincare for your clients. And like I said, they do have specific protocols that have been created with Plexr. And now we're going to talk about ActiveFeel. In our practice, we use a lot of this stuff. This is probably our most popular post-treatment for Plexr. So ActiveFeel offers 2 biorestoring formulas, Active Reverse and Active Firm. Those will aid Plexr in further reconstructing your collagen fibers and giving you those amazing tightening results. So these topicals are used and work based on the CD44 activation of your fibroblast. This is going to give your cells, the necessary ingredients, nutrients to help and rebuild that collagen and elastin and restore youth. So this is going to work in your deep in your dermis to stimulate collagen type 1 production. And type 1 is going to be the most vital type for your skin. So here is an illustration from ActiveFeel. This is illustrating the activation of that CD44 receptor, stimulating collagen production, the amino acids there over to the bottom right being provided to boost that growth, and then helping to add volume back into the face with the HA, or hyaluronic acid. Active Firm, this is one of the specific ones we talked about. This is a really great option for, I use it mostly for preventative, anti-aging, fine lines, texture pore improvement, those types of patients. A great option, works really easily. Haven't had anybody react to it. Super safe. It uses hyaluronic acid and aminos, and that promotes the skin rejuvenation. And Active Reverse is our other serum from ActiveFeel line. This is going to be used on your more mature or droopy skin. This also has the HA and the aminos in it, but it's going to add in some antioxidants, and that works to counteract free radical effect on your dermal matrix. So this is going to be for those more, age advanced clients or clients who have, maybe some more damage, whether due to sun or lifestyle habits, anything like that. So here is a beautiful before and after Plexr shower with an active feel application priced at $750 per session. And finally, step 3, proper aftercare to take home and enhance and elevate your results. This is a really great time to talk to your patients about their insurance policy, is what we call it at the clinic. So if you want your patients to take care of their skin, sell it to them as an insurance policy. I always tell my clients, you don't want to pay X amount of dollars for this procedure and then not do the proper aftercare, that insurance, to make sure this procedure lasts. You have the longevity from it and you're getting the maximum benefit from it too by using those serums that we send you home with. And so it's a really great selling point in my eyes. It makes sense. I'm definitely not going to pay, if you're already paying $1,500 for a procedure, what's another, 100 or so in skincare to make sure that you are maintaining those results. Uplifting has some great products and protocols that pair excellently for post-treatment with Plexr. Here's some other, these are the same products you saw on that other screen, plus concealer. That's a really cool product in the top left there. We love concealer in the practice. You can actually use it post Plexr, even for the ablative treatments. You can use it during that healing process or that social downtime, as we call it. This is great because it is concealing that healing process, but it's also promoting the healing process and helping to hasten the healing process. So that is a beautiful result. It does come in multiple different shades as well, which is great for all of your clients. All right, and now the glass lift, which is everything we've just talked about, Plexr Shower. It's just using the Active Reverse serum, which we just talked about. That was the one that was for the more mature skin in combination with Botox. And this price suggestion is $1,500 per session. This is also really great to market like pre-event, but it is important to give them time to get the results from it as well. So always make sure, and I would schedule a glass lift at least 10 to 14 days out from an event. So Plexr Shower, what we just talked about, Active Reverse, just spoke on that with the CD44 activator and collagen boosters. And then you're also going to add a microdose of botulinum toxin. You can use any brand toxin that you like, Dysport, ZMN, Botox brand, doesn't matter. You're going to get great results. It's just important to make sure that you have a dose high enough to get those results. And so for unit recommendations, the Active Reverse itself or the Acto Feel Firm, both of those come in sterile vials of 5 cc's. And so for the glass lift, it's going to be recommended to add 40 units of Botox or the equivalent into that 5 cc bottle of Active Reverse. You can do that, or sometimes in our practice, we like to use 20, and that should last you, by the way. So the 5 cc vial should last you for 3 patients. So you're using about 1.5 cc with each of those applications with each Plexr Shower aftercare. But you will add the 40 units into the 5 cc's and you can use that on 3 patients. Or if you wanted to use a higher dose for even better results, remembering that we're applying this, just topically, this isn't going into the muscle. So you can also use 20 units per patient, and then you could just mix that with the 1.5 cc's of Active Reverse. Obviously, you would do more units and more volume if you're doing the neck, the décolleté, if you're adding on multiple areas. It's important to use enough product because that's where you're really going to see the results. All right, so here is a before and after, 2 months after their first glass lift. So you can see the improved texture from the acne scars, and improvement of the skin quality as well. And that's on a 49-year-old woman. Another great result from a glass lift. I do want to note here what I thought was really interesting of this before and after. We can obviously tell that this woman does have some asymmetry. So I believe, her left lid is definitely droopier than her right. And to me, she looks a little more symmetrical in her after photo. And that can be achieved by either using a higher energy over that lid versus the right lid. We commonly do this in our practice, or by spending a little bit more time on that droopier side than than her more elevated side on the right. And so you can also use Plexr to kind of try to work on correcting some asymmetries and getting some tightness on one side to get you a little more even. Here are some great testimonials. Dr. Tess, that first testimonial is the one who helped coin Rockstar Treatment, that she actually does treat Paula Abdul. And so these are some really great selling points, I think, for your customers, that it can, one, be done on all skin types, two, which I stated earlier, that you can actually perform this treatment on the eyelids, low downtime with great results, immediate and long-lasting results from the collagen stimulation, and finally, for your practice specifically, that it is so lightweight and portable. This is super important because we actually will go to an Alabama clinic about once a month, once every other month, depending on our schedules, to treat some clients over in Alabama. And we can grab one of the Plexr pens while leaving the other two at our practice, and it can be used across state lines. So, I mean, it really is life-changing how portable it is. This slide kind of goes into different specialties that might use Plexr workshop. It is important, I just want to say really quick, to check your individual state laws and to know what level of provider you should be to be performing that level of Plexr procedure. So like I said, we all do Plexr Shower, but as far as the more ablative procedures, the semi-ablative and ablative procedures, myself and Jerry, who are nurse practitioners, as well as Dr. Crowley, tend to perform those procedures instead of our esthetician. And we're in Florida again. So here's a great picture of all of the tips. The triangle tip on the left is the one that we have been referring to throughout this presentation. That's the triangle tip you use for Plexr Shower. The XP tip, which is used typically in the semi-ablative cat scratch. The vaginal tip, obviously used for vaginal procedures, and the bended tip, which we use for some ablative procedures, very precise, like a blepharoplasty or the barcode lines, things like that. Plexr has a 93.4% patient high satisfaction rate. I think we're at 100 at Skin Tonic. This slide goes over some Plexr ROI stuff. I'm sure Jeffrey or somebody at Med Results could talk with you guys a little bit more about this, but just by looking at this chart, and if you guys want to take a quick picture of it, this does show different package costs that can be typical. Again, making sure that that's, appropriate for your area, and how much money you could be making per year on these different procedures. So it's also important, if you get a Plexr, don't limit yourself on doing a Plexr shower, a Plexr cat scratch, and that's it. You want to be doing nose contouring, neck lifts, acne scars, blepharoplasties. You want to be doing all of these different features that you can do with one device. So it's one device, comes with 3 pins, 4 different tips. So there's numerous things that you can treat. You can treat, gosh, almost everything with Plexr. And if we're like, oh, what should we do for this patient? We're like, let's just Plexr it. And so I think it's really important to make full use of your Plexr. And that's what I'll mostly say about this slide. How much money do you lose every month not having it? And so again, this is showing just by not doing one neck lift a week, you could potentially be losing $8,000 a month for that one indication. Another great before and after photo of crow's feet. Plexr is FDA cleared for the removal and destruction of skin lesions and tissue coagulation. We kind of spoke on this briefly about the built-in Wi-Fi, but you basically, I mean, obviously I have this device at home with me right now. Don't tell Dr. Crowley, I know he's on this call. I'm like, I may just like Plexr myself tonight after this. So I can use it at home 30 minutes away from my office, and it's charged up, ready to go. Again, we kind of spoke about this earlier with the marketing strategies, but they do have over-the-air software upgrades and remote troubleshooting if you ever do have issues with your Plexr. Like I said, we haven't had any, so can't speak on that personally. I've preached about the mobility of this device. Oh, the embedded training and demo videos. I thought this was super cool. I find myself watching these all the time. And I also think that this is a great in-practice marketing strategy. We have our Plexr workstation in one of our treatment rooms, our most frequently traveled treatment room. And so from there, you know, we can play the Plexr videos for the clients, showing them either what to expect. They can also scroll on the device and see all of the different things that can be treated with Plexr. And sometimes, you know, patients want to ask about something that they don't think that there's a solution for it. And so it's really cool to have those videos that they can watch right there on your Plexr workstation. This is a Plexr Plus clinical study library. So there's over 20 different clinical studies that have been done. You guys can take your phones out and scan that QR code there in the bottom left. And that will give you access to all of these different clinical studies. Pretty cool to look at, to research, and all of these great results that we've had. Okay, so this slide is about using Plexr to make a Botox result. I kind of wanted to touch on combination treatment, honestly, more than anything. We use, you know, neurotoxins, neuromodulators in our practice, obviously, and we also use Plexr. I think this is a great, great, great combination treatment. I know personally, like my mom didn't start getting the Botox until she was in her 50s. And so she had really bad 11 lines that were static lines, or lines that you can see when the person isn't making a facial expression. And so of course, you know, when you put your neuromodulator in there and you treat appropriately, they can no longer move. But if they do have a static line, while it might soften a bit, you know, you're still left with that indention, that static line that will last, you know, for possibly several more Botox treatments until it can finally get a little more buffed out. And so I think Plexr is a great thing to use for those patients who do wait later in life to get Botox to kind of help go ahead and start working and producing collagen around those static lines. Especially because people sometimes don't wait until, you know, they're about to, you know, somebody's getting married in a few months and they think Botox is going to fix everything. So, as well as fillers. I think this is another good insurance policy pitch situation. Taking care of your fillers and making sure that the texture and the quality of your skin over your fillers is good, or else your filler's not going to look good. And so I think there's a great marketing strategy here that could be used, you know, to give, you know, if Plexr's new to your practice, especially, you know, giving discounts on Plexr when they get filler, you know, saying, you know, you need to make sure that your filler looks good, and your filler's not going to look good under crepey skin, under lax skin. And so we can do things to tighten, and eventually, you know, with Plexr treatments, you know, they might not need as much filler as well, which is also great because as you guys know, aesthetics is really moving towards in the trend of bioregenerative medicine. Just some quick facts about Plexr. The original clean plasma made in Italy, 3-year warranty, very low cost consumables and disposables, quick ROI and high profitability, super important. And that is it. So I guess we can now go over to—
What a presentation. I mean, that was
you.
incredibly impressive. That was awesome. I felt like I was in an Empire training. You just sort of
I
covered everything, and you didn't just
really
cover it.
appreciate
You
it.
covered it sort of from my perspective, like from the first person, because you're actually using it
Sure.
in a daily practice. So thank you very much,
Yeah, no
Allie.
problem.
Yeah, great job, Allie. Very good. Impressive.
Thank you.
All right.
So tons of questions.
Yeah,
Tons of
good. A lot of
questions.
questions.
And yeah, Chris, you wanna hit the Q&A section? And
Yeah.
feel free to keep adding, folks, as things come up.
Yeah. Yeah, you're gonna get the most out of this by asking, really a lot of questions. I'll take some of these. Jeffrey, maybe you have some, and then I'll throw some over to Allie. Just a couple of things, kind of some that I want to address right off the bat. There's some things here about referencing different scopes of practice, NPs versus PAs. Certainly, this is no bias against PAs at all by any means. I mean, Allie's background as a nurse practitioner,
Yeah.
so probably just referred to as NPs, but certainly lots of PAs use this device. Yeah, throughout the U.S. So by all means, if you're a PA and you have an aesthetic practice, this could be something you could consider. We definitely have a lot of good PAs out there. And then the other thing is on scope of practice. So are autonomous NPs able to use it independently in their own practice, or is an MD required? Nothing that we tell you on these webinars are meant to be a substitute for legal advice at all. We are not lawyers. So I strongly suggest that you consult with your own healthcare administrative attorney. However, if you have an independent practice in Florida, it's not meant to be aesthetics only. And so this device is FDA cleared for destruction and removal of tissue. So you can use it for things like skin tags, hyperpigmented lesions. So moles, cherry angioma. So a lot of those things, independent practice NPs are doing in their primary care practice. And so by all means, you could use this device. And if you have an aesthetic portion to your practice, then you could also use this device as an NP for sure. But in terms of whether or not you can have an independent practice solely aesthetics, I'm going to refer you to your own legal team for advice on that. So the technique, we did show the video demonstration of the technique there. And so I think we can move past that. If you guys want to see more videos, we can certainly give you some links to that. So we have some online training so you can see this. It's a little difficult to demonstrate via Zoom. And then Allie, why don't you take this one on recommendations about what do we do for our Retina users before this, and also versus lasers? When do we ask them to stop that, or do we let them just stay on it?
Yeah, so for Plexr, I actually don't have a whole lot. A lot of clients will stop their Retin-As because a lot of our clients have them with hydroquinone on during the summertime. But stopping Retin-A, I think with a Plexr shower isn't as important. It's okay for the skin to be dry. I think it's more important in the aftercare, instructing them, especially within that 4-hour window, to not have obviously any Retin-A applied. I tell them, don't use a toner tonight. Don't exfoliate your skin tonight. We've achieved all of this already with doing what we did with Plexr. So I usually instruct my clients to hold their Retin-A really until their skin feels back to normal, which is typically 24 hours. To be safe, I usually say hold Retin-A for about a week.
Yeah. I'm a little more aggressive with that. And so I don't really, for sure. If you really want to be on the conservative safe side, have them stop. And especially if we're doing things that are more ablative, but focusing specifically on the Plexr shower and glass lift, because that's what we're talking about tonight. Allie is exactly right. We don't have to have them stop that at all. They can continue on their retin-A throughout the treatment cycle, being sure that they're not going to apply that really the day of treatment. So we don't want to within those few hours afterwards, but especially that day. And if they get a little bit of redness afterwards, you may want to have them hold it, the next day or so if it's irritated, but usually they're not. Usually they're a little bit red and the next day they're fine and they go right back on their regular routine. And so I don't think it's a big deal for this. Yes, for once we start talking about more ablative procedures with it, I would definitely recommend it.
Mhm. And then we got a question, is it safe to use in any skin color? Yes. So Plexr is safe on all Fitzpatrick's. We're talking specifically about Plexr Shower tonight. So I feel really confident about using Plexr Shower on all skin types. Am I going to use my red Plexr Shower pen on a Fitzpatrick 4, 5, or 6? I'm not. I would opt for one of the more lower watt energy of the Plexr Shower for those skin types.
Are we still doing traditional microneedling anymore? Only Plexr showers? And if so, how do you determine which one?
Yeah, so we still definitely offer traditional microneedling in the practice. A lot of patients have been doing microneedling forever, and that's what they're always going to do, even though we try to convince them to try other things. I really like to look at what the patient's skin concerns are. I think that especially if they have any laxity around the eye region, the periorbital region, that obviously Plexr is going to be a better result for them because you can't get close to the eye with microneedling. Honestly, I'm not. Chris, or Dr. Crowley, can you think of a time when you would recommend microneedling over Plexr Shower?
So I think, there's one's going to be patient preference for sure.
Yeah.
So in general, I love the slide where we show the basically what is being absorbed. And so when we microneedle and we get a lot of pinpoint bleeding or things on the face, it's hard. Our products are being diluted. So long before we actually had Plexr, I was talking about we probably are needling too aggressively. We don't need all the bleeding. It's going to dilute the product. With the Plexr and opening up the micro channels and having that absorb the product, I think we definitely have a superior result. We honestly, and you probably remember this, Allie, and we don't really struggle with it now. But in the beginning, we had trouble convincing patients to try this instead of microneedling. And especially when it had a higher price point, they didn't really want to do that. And so what we had to do was bring it in as we brought it in our practice as a membership benefit, and we positioned it similar to microneedling. And we said, you can pick either or. This is what we recommend. This is why. And then once we started getting more and more before and afters that were great and better results, we don't really have that much of a problem convincing patients to do it anymore. Now, kind of piggybacking on that. So just to wrap up that question, we still offer it. And there are some patients who prefer it. They've had great results with their microneedling and they want to continue doing that. From a business standpoint, it makes sense to do the Plexr showers in place of that. So the patients are going to have better results. You're going to be able to do this without topical numbing. So I know we talked about that a little bit. And one of your questions are, what are you doing for patients feeling pain during the procedure, especially periorbital? I went in Allie's treatment room today and she was treating a patient doing a shower, and she was using the higher energy handpiece on that patient, and they had put BLT on the patient. So a topical benzocaine, lidocaine, tetracaine cream for topical numbing. But in general, I don't find that it's necessary for these procedures. And so because of that, we can do 2 of these per hour in a room versus 1 per hour with a microneedling, because the microneedling takes a little bit longer with the numbing. Now, if you're numbing for this, they're going to take around the same amount of time. And so it doesn't save a lot. But if you're not numbing, which most patients don't need it, then we're able to get them in and out quicker. So it makes more sense from a business standpoint. The patients get better results. And so they're coming back for more things in the practice because they're happy with what you're doing for them. Okay.
Dilution for mixing Botox for topical application. Whatever you use in practice is fine. Like I said, if you're going to put it in the full active reverse 5 milliliter vial, Plexr recommends using about 40 units, or you can use 20 units per patient and also mix that with the 1.5, 2 cc's, whatever you need to cover the area fully for that patient. So it doesn't matter the dilution as long as the unit amount is correct.
Yeah, correct. I think that's really important. Like a lot of people focus on, do we put a 1 ml dilution or 2.5? We don't change it a lot in our practice. We use Dysport primarily, and we keep our dilutions, reconstitution the same. And as Allie pointed out, your number of units is really important. We do use a little bit higher number of units than is recommended in the glass lift protocol. Obviously, the glass lift is really popular. A lot of celebrities get it. Paula Abdul being one of the most famous that talks about it. And so, we love to put that everywhere. But I think to really get the result, I like to use about 20 units per patient. And so when we put 40 units in the entire vial of Acto Reverse, that will treat about 3 patients is what we typically get out of, one vial. And so they're not getting as many units, quite as many. And so I personally like to draw out our Acto Reverse and then put the toxin directly in there, 20 units, and apply it after the Plexr. And that's how we're doing it at Skin Tonic right now. Yeah, Allie, you want to take the next one?
So how exactly to do glass lift and how long and which pen. So the glass lift is literally just Plexr Shower. So what we talked about earlier in the presentation, the photo that you guys saw of the 5 different sections of the face drawn off. So you're going to have 10 sections total when you talk about bilaterally, and you're going to use the 3-minute timer on the Plexr pen. So the Plexr pen, when you turn it on, this light comes on, and then once 3 minutes is up, it's going to go off. And that's your key to move to the next section. You'll do that 10 times total for all 10 sections of the face. And then you apply that Acto Reverse and Tox serum that we just spoke about. As far as the pen selection, like I said, it can depend. Like I typically use lower energy pens for higher Fitzpatrick's. That's a primary goal. If a patient wants like absolutely no downtime at all, and it is low downtime, it's really, but can you also use a higher energy pen and get some dryness a few days later? Yeah, you can. And you can have some temporary pinkness or redness, splotchiness immediately following the treatment. And so I think it's important to talk to your patient about what kind of downtime they're comfortable with. And then explain to them why you're selecting the energy for that treatment. So super low downtime, I'm going to use one of the lower pens. If they're like, get after it, I want the maximal results, I may tend to use a little higher energy pen, and I'm like, okay, you may be a little flaky a few days from now, but it's gonna look real good, and they're happy with it. So that's kind of how I approach it.
All right, I'm going to combine a couple of these questions because I think they're really good, but I think they kind of feed into each other. And I know you guys can't see what other people are asking, but we have one on here about complications, rare it appears, thanks, and then about using, the type of the energy pen that we use and treating darker skin types. All of those kind of run together. So I want to kind of give a little bit of an anecdotal story and a little bit about my misunderstanding of the technology. And guys, keep in mind, many of you, if you've had classes with me, you've heard me tell the story of the first energy device we ever bought was a CO2 laser, and it was over 13 years ago. It was super aggressive, and we had so many wounds to manage. I was terrified of devices, but we really got these drastic results. The patients who did tolerate it were very happy with the results, but it took them weeks to get through that. And we dealt with the, post-inflammatory hyperpigmentation and wounds and this oozing from the face. And so I really got okay with managing that, but I hated it. And I really didn't want to do energy-based devices, but also I was pretty comfortable with some more aggressive treatment. So when we got this device, and I did training with the Rosh, and I thought, well, yes, he's being super conservative. He doesn't want us to have any problems with the device. And I want more drastic results more quickly. And so the biggest problems that we've had in the practice, and I really don't want to mislead you to think that there are zero complications. With any energy-based device or technology you bring in, you can have complications. And that learning curve in the beginning can be a little bit steep for many of us. So even after this many years in practice, there have been things that we continue to learn. So when we got the device, I thought they're super conservative. I want more aggressive results more quickly. And I used the higher energy. So I used the red handpiece, the 2-watt handpiece on quite a few patients, either me, Jerry, or Allie. for things like the deep perioral lines or barcode lines or some of the blepharoplasties. And those patients did have some pigment problems afterwards, but it was more not long PIH, it was more redness. And it went away probably within the longest we had was maybe 6 to 8 weeks. So the more I looked into it and I talked to Rosh about it, and we did some filming, some training videos, and I look forward to some of those coming out soon that you guys will be able to see them. But we're talking about it and he's like, you're using the red handpiece way too much, like back off. And
We love that thing.
we love the red handpiece, right? It gets great results. But I told him, I said, to me, it really does speak to the safety of the device. So yes, we are getting equally as good results now using the lower energy handpiece and selectively picking that red one, or using the red one, maybe some for our showers, but we're getting really phenomenal results using the lower energy. And with that, we're not getting nearly the pigment problems. So, I'm thinking, why, as medical providers, we always want to get the most bang for our buck and we want to get to the end result quickly. And when you're looking at them, sometimes it's hard to see. It's a spark coming out of the end of this little device. And so our eyes have a little trouble picking up on the energy. And so it looks similar to us when we're delivering it. But in reality, with that red handpiece, we're putting a lot more energy into that tissue quickly. And so I'm amazed, as many as we did, that we didn't have more problems with pigment, and that really redness was the main thing. We had one lady that was a little dark around her mouth, but it was literally 6 to 8 weeks. And people have come back, her friends, to get the Plexr treatment from us because they're like, we don't know what you did to this person, but they look amazing. We want our lips to look like hers look around it there because she had such a good result. So it is rare to have complications. It is important to pick the energy level appropriate for the patient that you're treating. We do treat a lot of fits 1 through 3 in our Patrick, and 1 through 3 Fitzpatrick in our practice, but we do have some of the 4 through 6s. And with those, we actually just adjust down to lower energy. And as long as we're matching that properly to our patient, we rarely have any complications. Okay. So, how dramatic of a difference are you seeing between the white and green hand pieces for Plexr shower treatments, which you're using most commonly? I'll let you take that one.
Probably I most commonly use the green, which is going to be the 1 watt. Yes, I have the 0.7 one here with me today, the white. I most commonly use the green one, probably. Just because I feel like it's like the middle one, honestly, like at 0.7 to 1 watt, you're not going to see a crazy difference. I think as long as you're giving a thorough treatment, you're doing the 5 sections, you're spending the time, you're using the proper speed, and really getting enough of those channels open, I don't think that it makes that crazy of a difference, especially between the white and the green. And if I'm being honest, probably not between the green and the red either. If you're using proper speed and technique while you're doing your Plexr shower, you're going to have microchannels opening, and that skin is going to be receptive to product. And that's what's most important here. You may have a little bit more skin tightening, a little bit more tiny removals of skin with the higher energies. I think a bigger difference when you're talking about the red. As far as the white and the green, I don't think it's a huge difference.
No, I mean, I absolutely agree with you there. And I mean, in all honesty, you probably have the white with you today because I've had the green with me in Naples. And
that's right.
I got back, right?
I've been wondering where it was. That's why
I've had the green with me. So definitely we can take them many places and use them at the same time. So that's good. Recommendations for hyperpigmentation on skin types 4 and 5. And so I don't know if this question is related to hyperpigmentation after a procedure. So if you've had PIH or post-inflammatory hyperpigmentation, we definitely want to avoid further inflammatory insults. That's only going to worsen that condition. So PIH will go away with time. There's a pretty famous dermatologist that does really aggressive work in Australia on very dark patients. And it's interesting because he has beautiful results, but he actually says from the beginning, PIH is part of your recovery process. We're going to be aggressive with this. We're going to take care of it, but you're going to have some pigmentation afterwards, and it's going to get better over time. So really, to minimize any kind of inflammatory insult is going to be key. And then if you're going to go down the treatment pathway, using some sort of device that's going to cause minimal inflammation are topicals. Time is going to be your best friend. Time is it. I haven't had really any long PIH with the Plexr, honestly, we've had some redness. But if I had PIH in the practice, what would I do with it? I would recommend time. And if I didn't, I would probably consider something like a microsecond pulsed Nd:YAG. It would be what I would use in our practice. Okay, I'm having diffuse pinpoint size skin rashes on my face after the Plexr treatment 4 days ago. Is it common after the treatment? How do you treat it? And do you recommend topical steroids? Number one, I don't think it's common. It's difficult to give general, advice because without actually seeing you, seeing the rash, knowing all the other things that factor in, right? So what was used after it, what product was used, because more than likely this is not the Plexr, it's going to be the product you applied afterwards, because the skin is very porous right after this treatment. And so after that, you could have it. The other thing is the technique it was used. So if you were to rotate or tilt the device somewhat, and deliver energy through the corner of the shower tip, it's going to be more focused treatment. So even though it's not a pinpoint treatment like an ablative treatment or a scratch treatment, you can, if you're not careful with keeping this basically flat on the skin, you're putting your energy through just the corner of this, and you will get little bumps all over your face from that. And if it's bothersome, if it's itching, if you think it's some sort of allergic reaction, you can try topical steroids. If it's really itchy, maybe an oral antihistamine. It's very common after our ablative procedures that they have a lot of swelling and maybe some itching. And we do use some oral antihistamines for that, and that usually seems to work pretty well. All right, let's go to
we kind of talked about hyperpigmentation, like using lower energy tips, especially with the more like the needle point tips or the cat scratch, using a lower energy pin in combination with that.
Yep. So use lower energy to try to prevent it. With Rockstar Glass Lift, is more than one treatment recommended, and what's the spacing? How long do they last? To me, and this is where I'm probably going to vary a little bit from some of the stuff that the med results will kind of tell you. I don't really think the results last that long, but I also don't think they last that long with micro needling with topical Botox. I believe the results that last a long time are going to be from your ActoFirm product. So the ActoFeel or the Acto Reverse that you apply after the Rockstar treatment. The toxin itself doesn't seem to last very long when we put it that superficially. And again, whether I do it through microneedling or Plexr, I'm saying around 2 months with that. Definitely not the length of time that we get this if we inject the on-label dose into the muscle. And so I'm getting around 2 months with it. Allie, that's about what you're seeing as well? I mean, we talk about this frequently. So
yeah,
about 2 months is what we're getting in our practice with that. And so if they want that kind of tight saran wrap look that they get, they're going to have that more frequently. They're getting longer results from this treatment, but the longer results are actually what you're seeing from the collagen stimulation. So even if we took the toxin out of it and just did the Plexr Shower and applied our ActoFeel or Acto Reverse, around that 2 to 3 month mark, it's when those fibroblasts are really active and they're making a lot of collagen and elastin. And so the results you're seeing at that point are not necessarily from the toxin. That is from the collagen stimulation from that treatment that you performed months before. And so, it's a little bit of a fine line there. So we have it in our practice where they can do it as part of their monthly membership program, or if they want to, do other things, they can get it for a discounted price if they're one of our members.
Any special pre or post treatment with Rockstar Glass Lift? I do the same as for my regular Plexr showers, no real pre-treatment, post-treatment, for 4 hours, just applying what we've given them from the practice, whether that's ActoFirm, Acto Reverse, or in the glass lift, the active reverse with the toxin. And then that night I tell them that, they can cleanse their skin with a gentle cleanser. If their skin still feels kind of sensitive, they can also wait until the morning to use a gentle cleanser. That's fine. And then obviously no exfoliating or toning just until your skin feels back to normal. Everybody's going to heal at a different rate. And I always recommend after any energy-based device that we're using on patients, just stay out of the sun as much as you can, re-educate them on sunscreen to be used consistently always and forever, not just around Plexr, but any device or just whenever you're not getting devices too. Living in Florida, it's hard to convince people of that, but we try our best. So yeah, pretty much just,
and so
stay
kind
out
of on that, and there's also a question here that ties into that. How long is it recommended to avoid chlorine pools, hot tubs after a Plexr shower glass lift? And I think that's, again, keep in mind those channels are open 4 hours. It's going to be more sensitive. And the vasodilation and vasodilatation and sweating that they may get from being in the hot tub is probably not going to be best within that time frame either, because it's going to dilute maybe whatever we have on topically. So I definitely recommend 4 hours for this. And if we're doing anything more aggressive, it's going to be until those wounds heal. So at least a minimum of 4 hours after the glass lift or shower. And that's just part of our post-procedure care as well. Let me jump into this one on getting into this space, into aesthetic space. Where do you start? So many options, and you're not interested in threads, fillers, neurotoxins, and you're more on the energy-based treatments. So, if you're interested in getting into the space, and you just want to do energy-based devices, I really think you need to analyze your market, and you need to make sure that you know what type of patients you're going to be attracting, and be sure that the device that you're going to bring in matches what your clients are searching for. And a big example of that would be if you're in, a market where you're primarily getting maybe 60 to 80-year-old patients that are in a retirement, village, and you buy body contouring devices that are $300,000 to $500,000, you may have trouble, making your money back on that. So their issues are going to be a lot different than if you're in a beach community, coastal community with an average patient age of 40 to 60. So getting into the space, you need to understand your market and what your patients are going to look like, and then you get devices that match that. And so does that device fit is it approved for all skin types? Are you treating primarily Fitzpatrick 1 through 3? Or are you treating 1 through 6 or primarily 4 through 6? Because that's going to alter what device you're going to get into your practice. For aesthetics in general, it's not that you can't do a practice on only energy-based devices. By all means, you can focus on that. But a lot of your marketing and a lot of the ways that you're going to find patients are going to be through some of your basic stuff. You don't have to do aggressive threads. A lot of people never do that. But something like your neurotoxins and fillers are going to be kind of a core of many aesthetic practices. Not all of them, but many. It's not your highest margin, but it's what gets people in the door to really get other treatments. And doing these combination therapies are where you're going to get the best results for your patients and, the most profit for your practice. So, attending some trainings on this, or even if you don't want to attend training, start doing a market analysis. So look at what is it, where is it that you want to open? If it's in your primary practice, if you're a primary care physician, then look and say, what is my demographic? What do they look like? And how am I going to work this into my day-to-day schedule? And then figure a device that fits into that. The other big thing I would recommend is make sure you check whatever state you're in, your scope of practice laws. And so you understand if you have to work the device personally, or if it's something that you can delegate to other people within your practice. There are, across the US, there are different state laws about who can work what type of device. I hope that helps.
How often do you offer Plexr Shower to your patients? Is it once a week or once a month? We say every 4 to 6 weeks, especially if you're going to do a series of Plexr Showers. We say every 4 to 6 weeks. As Dr. Crowley was saying, we offer it in our membership package, and they get one service per month from a variety of choices that they can get monthly. Contraindications for pregnant or breastfeeding. Yeah, Plexr, it's another one of those things. Would it hurt them? Probably not, but we don't know because we're not going to test anything on a pregnant or breastfeeding mama. So no, we do not do these on pregnant or breastfeeding patients.
Yeah, let me just throw my own 2 thoughts and 2 cents in there. Allie is right. It's not likely to hurt them. It is, mildly inflammatory. This is something that if, we had a pregnant patient come in or someone breastfeeding, and Allie or Jerry were to talk to me individually about approval, I would probably approve it for that patient. So we definitely don't do, injectables and things like that. It's interesting because we have so many patients that come in and get their neurotoxin or their filler, and then they find out that they're pregnant a few weeks later. And some of them freak out and like, oh my gosh, is it going to hurt the baby? And other ones are pretty okay with it. And they're like, thank God I got that before I found out, because I know you wouldn't do it. And so we take a lot of precautions because we really don't want the legal risk associated with doing something that may, impact a developing child or a baby. But the Actofirm and the Actofeel, Acto-Reverse, those products, they are hyaluronic acid based. So we all have hyaluronic acid in our body. They have amino acids and vitamins in them. We're putting them topically on someone's face. So I feel actually very, very safe about doing that. So although we don't say it has an indication for that, as you can make a decision as a medical provider, and this is something I would feel very safe doing in that patient population, I would forego the neurotoxin. And again, do I think topical neurotoxin is going to hurt the child in some way? Probably not. But, we generally avoid that. And so it's not something I would say, look, if we're going to do it, let's look at things that we can do safely, because we know that, during pregnancy, people, they still want to look good. And a lot of times they do. So they have some fullness, their hormones are kicking, their skin's glowing already. And so they may not even need a lot, but it is something that I would feel very comfortable, especially with the Actofeel line of products, because they are amino acids, hyaluronic acid, some vitamin C and glutathione. So my 2 cents. Chlorine swimming pool after exposure after ablative Plexr. So after ablative, so this is going to be when we're doing the soft surgery, I want those totally healed. So that's probably going to be somewhere around 7 to 10 days. Other than that, I don't want them in there because it's going to dry them out more quickly. And one of the things that will increase your chance of PIH is premature flaking off of that. So people who are swimming in pools, getting them really wet and moist and trying to rub them off, it's going to increase the chance that they're going to have any kind of PIH. So I really would tell them when that is all healed, which is probably going to be 7 to 10 days. Okay. Allie, you want to take, can you do cat scratch method with lower frequency using the bended tip?
Yes, you can. I like the I'm assuming they're meaning like the needle point, the bended tip. Yes. So you can. I typically like to use the hairline one, though. It's going to be a little higher energy, keeping in mind because it is a smaller pinpoint on the end. So all of that energy is going through a smaller tip. So it is going to be higher energy, but you can use the lower energy pins, and that will be fine. It's a lot easier doing, in my opinion, the cat scratch method with that bendy tip versus the needle tip. Sometimes I feel like that can be a little more uncomfortable and unnecessarily so.
Yeah, for those of you who may not, and so I'm guessing that you have a Plexr already, the person who asked that question, but some of you may not have a Plexr. And so there are 3 different tips, and you can go and see the references. One of them looks kind of like a clothes hanger, a coat hanger. It's a wide tip that you saw Allie demonstrate today. It was in the video. Put it a little bit close. Yeah, there you go. That one, that's our shower tip. And then we have a needle tip, and the needle tip is actually, it's more like a pencil tip, right? Has an angle to it, but it literally is like a needle. And then there's one called XP, and the XP is literally like a little hair. It's very thin. But remember, the energy that is being dispersed through that is going to be spread widely across the one she just showed you. It's going to be focused down to something that's like the size of a pencil lead or a pencil tip on the needle. And then the extra power or the high power one is focused down on something like the size of a string. So we're putting the same amount of power into a smaller and smaller and smaller pinpoint. So that XP, or the one that's super flexible and thin, it is higher power, but you can definitely scratch with it. Okay. I'm interested in a protocol for the day before or day of the wedding. I have a group of parties interested in this in the future as their recommended treatment. I'll tell you what I do. I mean, I personally love it before any big presentations, and I'll do it the night before but your trick is going to be to use your lowest energy. So definitely use the white handpiece. You don't want to get too much redness or irritation. In the areas that you want lifted, just do multiple passes in that area. And then you're going to use I'd really love to use the Acto Firm for those. And so the true benefits of the Acto Reverse. It's a little bit more expensive product. It has the vitamin C, the glutathione. It's a little bit stronger for pigment and stuff, but the real results from that are not going to be seen for weeks. And so it's a little bit more cost effective for you as a business owner, and they're going to get that immediate results from putting your Actifeel on right afterwards. And so I love that for kind of like the day before or day of.
Yeah, I would just go super light. And also, if you do have access to these people beforehand, do it on them a month before as well. A, for results. B, to make sure that they don't have any type of crazy, I don't know. I get so scared with weddings.
Yeah. I mean, weddings are
But
scary.
it is like, we've never seen that, like anything bad happen using the low energy Plexr Shower, but
No, and you guys know me. I'm a chicken when it comes to procedures. And the way that Arash actually got me convinced on the Plexr, somehow I had a weak moment and I let him do a Plexr shower on me in New York. And I looked great for an event. And I was like, wow, I love this. I did it a time or two again and loved it even more. And that's kind of one of the ways we brought it into practice. And so definitely those packages are good. If you have time, by all means, doing it earlier than later. And also avoid mixing a lot of products or a lot of new products, because really, we haven't had problems at all with the Actifeel line of products. And so I feel very safe of putting that on. But a lot of other things that we use, even new skincare lines, people may react to it. And so really kind of avoiding that the day of would be really important. So Allie, you want to take the one on energy level, and then I'll take the last one on resurfacing.
so energy level, which color handle for an ablative treatment for a skin lesion removal. So skin lesions or scar tissues or keloids are actually where you can use that red pin, the 2-watt energy pin, because that tissue is going to be thicker. Obviously, it depends on the tissue, depends on the patient, depends on the size, all of those things, but you can use for those harder to ablate tissues, you can use the 2-watt energy pin for those specific reasons.
It's going to help you remove it faster if you use the higher energy. That's the bottom line. If you're trying to flatten out an area, if it's a higher Fitzpatrick, I would still go with the lower ones and just take my time removing it, and maybe have them come back for a subsequent treatment if necessary. All right. The other question is, I'm having difficulty convincing clients on cat resurfacing in lieu of the ablative soft surgery techniques. Do you have difficulty with the sale of cat resurfacing? I mean, I don't know, Allie, you're probably interfacing with the clients more than I am. I can tell you my thoughts on it. I think maybe it's the way that you're positioning it, because I don't even think of them at all as the same procedure in my mind. And so when I've had discussions, I would say, no, I haven't had problems, but I've never positioned them as a similar or an equivalent treatment. And so when I'm talking about a soft surgery, we're really talking about destruction and removal of tissue, which is what this is FDA cleared for. Everything else, we're kind of talking about ways to use that device to create these beautiful results. But when I'm doing soft surgery, I really am removing some sort of tissue. When I'm using a cat scratch technique, it's basically a collagen induction therapy, and it's a more aggressive way to stimulate the fibroblast. And so I'm focusing the energy more intently. I'm stimulating the fibroblasts more. And if I'm really wanting to see overall lifting and maybe some mild resurfacing and pigment changes, I'm going to have to be pretty aggressive with that cat scratch. And so it's going to be more downtime than my Plexr Shower, more aggressive results, but it's still going to be a fraction of the downtime that we would have with our soft surgery. And so to me, I'm kind of positioning them differently. I'm thinking of cat resurfacing more as a general overall treatment for evening skin tone, collagen induction therapies, bioregeneration. And I'm thinking of soft surgery specifically for removing tissue.
I agree completely. I don't ever really like, we kind of, me and the patient talk about what the goal of treatment is. And if they say, well, I have these saggy eyelids, we're going to remove those with Plexr soft surgery. If they just want general over all tightening in their skin and they've got plenty of downtime and they need more of a cat scratch approach than a Plexr shower, then that's what we're going to do. Generally speaking, cat scratch, I'm doing it over the full face, not necessarily just an area, unless we're talking about maybe a small area of the neck. Generally, it's a full face procedure, whereas the soft surgery procedures or more ablative procedures, we're doing those on specific areas. I'm not ablating the whole face. I'm doing a blepharoplasty. I'm doing, the barcode lines. We're doing a specific area, not a whole face.